Would you like to save time and energy while producing the same physiological results and even improving some areas as someone who spends hours in the gym? We will tell you how this is possible.
This is Garrett Freed
And Megan Thomas.
We are two undergraduate exercise science students studying at Western Michigan University. We have researched the effects and importance of high-intensity interval training and would like to share why we believe it is such a vital piece to fitness programming for optimal health and improving athleticism.
So, what is HIT? According to Barclay and Sharev, high-intensity interval training involves repeatedly exercising at a high intensity for 30 seconds to several minutes, separated by 1 to 5 minutes of active recovery. The most common HIT test, confirmed by Gabala and McGee, is the Wingate protocol, which was developed in the 1970s. This involves 30 seconds of cycling at an effort above 90% VO2 max against a high braking force, followed by 4 minutes of recovery, then repeated 4 to 6 times within one session. Here's a short clip of a Wingate test conducted at the Gatorade Sports Science Institute to show you how intense HIT-based activities can be.
Here we go, stop, get ready, head down, 3, 2, 1, let's go, 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 go! Great stuff, great stuff.
So, why is HIT important to us, and how will it help us achieve our goals? Well, as most of us in the healthcare field know, one of the strongest predictors of morbidity and mortality is cardiorespiratory fitness, which is basically our aerobic capacity. One of the many benefits of incorporating HIT into our routine is that it significantly increases aerobic fitness, even more so than moderate intensity continuous aerobic exercise, which is the most common form of aerobic exercise practiced today. Additionally, HIT has been shown to widely improve various areas of athleticism and fitness in many different groups of people. This is important because HIT is a form of aerobic exercise that can be safely practiced by people with disabilities and disease, recovering cardiology patients, and all people in between there and elite athleticism. Aside from physical gains achieved through HIT, studies have shown that participants have an overall increase in their perceived quality of life. This is important because of the lack of motivation that many people admit to as a primary reason for not adhering to fitness programs.
The main reasons we believe high-intensity interval training is important is for the increasing athletic performance as a superior method of increasing aerobic capacity in various rehabilitating patients, and because its game-like nature promotes adherence to fitness programs. HIT improves overall fitness and promotes advanced athleticism in many different ways. HIT improves several metabolic processes during exercise. One of these is maximal oxygen uptake, also known as VO2 max. All of the research studies we found that tested HIT against consistent intensity endurance training showed that HIT test groups all had a greater increase in VO2 max. The studies conducted by Hafstad and Peers and Gabala and McGee both showed that the HIT increased VO2 max by approximately 23 milliliters of oxygen per minute compared to only 14 milliliters of oxygen per minute in the moderate intensity control group after only 10 exercise sessions. This is important because the greater a person's oxygen uptake during exercise, the faster the person will be able to generate the energy required for endurance activities. Improving an athlete's VO2 max can significantly increase the time to fatigue and decrease the time it takes to complete the endurance-based activity. According to Sharev and Barclay, muscle oxidative capacity is another way that HIT can improve metabolic processes during exercise. This is important because it relates to the amount of oxygen that can be utilized to perform work. So the more oxygen a person can utilize, the more work that can be performed. Lastly, improving substrate utilization specifically fat oxidation, is another benefit of HIT, which has been proved in various studies, including those conducted by Halstead and peers and also Sandback and peers. This is important because elite endurance athletes need to be as efficient as possible in regards to substrate utilization for optimal performance.
Aside from lowering blood pressure and reducing resting heart rate, HIT has also been shown to increase high-density lipoprotein, or HDL, cholesterol, and decrease the amount of low-density lipoprotein, or LDL, cholesterol, according to Sharav and Barclay. This is noteworthy because HDL is responsible for removing lipids from artery walls and cells and transports them to be filtered by the liver for reutilization or excretion. Some of the other physical adaptations promoted by HIT are increased gait speed, cadence, and stride length. From the study performed by Boyne and peers, we know that incorporating HIT into one's fitness program can yield significant improvements in faster over-ground gait speed compared to conventional endurance training. Figuratively speaking, the HIT group increased gait speed by over 1 meter per second, where the control group only increased their gait speed by 0.3 meters per second. Cadence was increased by the HIT group by 47 steps per minute in the same study, compared to only 17 steps in the control group. Stride length was also lengthened by 0.3 meters for the HIT group and only lengthened by 0.1 meters in the control group. This is significant data for endurance runners to harvest. Additionally, time to fatigue and time to complete a task are other areas that are noteworthy from our research. From the Boyne and Sandback articles, we found that HIT participants only trained for 20 to 30% of the total time that the continuous moderate intensity participants trained for, but gained similar physiological improvements. These HIT athletes were found to be able to complete a 12-kilometer roller ski test and a 7-kilometer hill run test faster than the athletes that had only trained at a continuous moderate intensity. HIT is a great way for patients with varying diseases to improve upon their aerobic capacity. Heart transplant patients must incorporate aerobic fitness programs into their rehab programs for reinnervation of the heart. We know from the study conducted by Lavie and peers that these patients experienced greater sympathetic efferent reinnervation following an HIT program compared to a moderate intensity program. These patients also improved their overall exercise capacity after the 12-week program. Patients with coronary artery disease and coronary heart disease that followed an HIT program decreased their body fat percentage and their body mass index compared to moderate intensity groups that did not show any change in these categories, as reported by Niotrin and peers. In regards to chronotropic response index, HIT participants had a drastic increase compared to the control group that did not show any change. This is important because the chronotropic response index refers to the change in heart nerve impulses over time. So, for heart transplant patients who have a significantly decreased chronotropic response, HIT can greatly improve their reinnervation and aid in a more successful recovery. According to the study conducted by Hülselboss and peers that tested a single adolescent cystic fibrosis patient with a ventilatory limitation on the effects of an HIT program, HIT may be an effective and efficient training regimen for child CF patients. In this particular study, after 6 weeks of HIT, the patient had an increase in peak oxygen uptake of 19% and a 16% increase in peak workload. The subject also had a rise in peak ventilation from 50 liters per minute to 75 liters per minute, with an increase in both respiratory rate and breathing depth. This training regimen also put the least amount of strain on her respiratory system, while still providing the physiological benefits of aerobic exercise.
A common reason for not exercising is time constraints. HIT is practical for all people because of the extremely time-efficient manner that it is performed. According to Boyne and peers, HIT requires around 70% less time than moderate intensity endurance programs. An article authored by Dunham and Harms discusses that even though HIT requires a considerably less amount of time than moderate intensity programs, HIT still yields similar benefits. Going back to the article authored by Sharav and Barclay again, they report that program adherence to exercise programs is less than 50% after a 6-month period. HIT, however, shows higher rates of adherence partly because of lesser time investment. According to Gerard and Pierce, the game-like nature of HIT makes it an attractive alternative to the often boring moderate-intensity aerobic training. This article also reports that HIT participants had a greater perceived quality of life due to the fact that HIT can be incorporated in all levels of medical rehabilitation, including the most deconditioned patients. Now that we've discussed many of the positive aspects of high-intensity interval training, let's talk about some of the possible negative aspects of the training. One of the biggest concerns with HIT is that since it is a new training concept, many people still do not fully understand its effects. Most of the research available comparing HIT to moderately intense aerobic exercise lacks large test subject groups and does not test long-term effects of the program past a few months' time. Scientists and doctors do not yet know what the optimal HIT program length should be for the various groups of people, which makes prescription difficult.
So, moving forward from this research, we believe that there is a lot of potential for HIT to be incorporated into various types of fitness prescription. There is a lot of gray area still surrounding this topic, and hopefully leaders within the field will continue to study this type of training so that we may all better understand its effects. We believe that HIT is important for increasing athletic performance as a superior method of increasing aerobic capacity and various rehabilitating patients, and because it is game-like nature promotes adherence to fitness programs.